Fleeing the Ukraine on foot, my great-great-grandmother used to cook for a Russian baron. She would later sit for tea with the Queen of Holland before going to America with her 3 daughters, eventually settling in St. Louis. She taught her daughters how to cook, who then taught their children how to cook. This passion for food and teaching people how to cook was then passed on to me. It is the reason why I became a chef and a dietitian, and the reason why I'm right here today. 5 years ago, I began organizing pop-up teaching kitchens for medical students across the whole country. In 2019, this is one that I organized at the University of British Columbia. This was a med student. She told me this was the first time she had cooked anything in her entire life. She said of this experience, it would ultimately make her a better physician. Learning about food in this space has power. Unfortunately, many medical learners report dissatisfaction with the level of nutrition training they receive in medical school. This issue has been taken seriously in the United States. Just recently, the US House of Representatives passed a bipartisan resolution that would mandate more nutrition training in medical schools. Essentially, the US government said, we'll stop paying for medical schools if you don't take this issue seriously. That's a big deal. Canada is in the middle of a chronic disease crisis centered on food and dietary habits. We have to admit to ourselves what we're doing, how we're funding, how we're programming isn't working. It really needs a serious rethink. My vision for the future of healthcare is to have teaching kitchens in universities, schools, healthcare programs, libraries, and community centers. Places where health professionals, staff, and the public can learn about food and nutrition together. I want you to think about a new type of hospital where teaching kitchens and vertical farms and rooftop agriculture are equally as prioritized as surgical suites and isolation units. Places where the public, staff, and professionals can learn about nutrition in a collaborative environment. I want you to think about a new future of healthcare where chefs and farmers and dietitians and physicians collaborate on chronic disease care, where the gap between urban and rural is lessened, where tradition and innovation coexist to make our lives better. I want you to think about a new type of healthcare where nutrition is taught through interactive models, where nutrition recommendations are contextualized in food. We have to remember, people do not eat nutrients, they eat food. Food is something that should be held. It's something that should be touched. It's something that should be smelt. If we're expecting people to do anything positive with it, to change their life. Nutrition recommendations need to move away from cliche slogans into teaching people how to actually do something that's going to change their behavior. I often bring up this analogy in the workshops that I do because I think it's really fitting. Think about earthquake preparedness training. What did you learn? What did you not learn? I'm pretty sure you didn't learn about P waves and S waves and transverse faults and subduction faults. No, that's ridiculous. What you did learn how to do was to save your life in the event of an earthquake. What's another example in our lives? Think about CPR training. I'm pretty sure you didn't learn about veins and arteries and the cardiovascular system. That's kind of ridiculous too. What you did learn how to do was to save somebody's life in the event of emergency. Nutrition education is no different. We have to teach people how to do something with the information if we're expecting a change. As policies and guidelines shift their focus to food and dietary habits, we need more collaboration, more funding, more programming, and people to actually really care about this if we're going to make a difference in this space. In the US, strides have already been made. Over 50 universities, countless numbers of hospitals have seen the vision for teaching kitchens, and they're moving ahead in this space. In fact, this fall, UCLA is about to open a new $3 million teaching kitchen. Other organizations in the US, such as YMCAs, US Veterans Administrations, they see this vision too. Our Canadian counterparts at the Alberta Health Services, Northern Ontario School of Medicine, and University of Toronto, they see this vision too. So should we. I was recently trapped in the United States after contracting COVID. While it did have its challenges, there was a lot of silver lining. I got to meet a farmer who started a not-for-profit that was associated with the farmers market and Missouri healthcare system. From pop-up tents to a new agriculture park, they're about to put in a teaching kitchen as well as expand operations to support food banks, as well as expand opportunities to teach kids about agriculture and where their food comes from. This is where we need to be, but we're just not there yet. I also got to share my vision for the future of healthcare with my dad. He's a neurologist and a dean of a medical school, and he can't crack an egg to save his life. While he could counsel me on best practices, patient care, the what, the how, and the why, all of these I'm learning because he's my dad, he's my elder, and he's helping this come to what it needs to be. I also said, Dad, this is gonna be really fun. Thank you.